Okay, welcome everybody. We have some people here in the room with us that are watching it live, and then we should have some people that are watching it live stream also. I just want to welcome you to the Wichita County Employee Benefits presentation. This is for open enrollment for calendar year 2020. My name is Linda Castillo, and I'm with the Wichita County Auditor's Office. Also presenting today is Corey Liner. He's also from the County Auditor's Office, and Deborah Stevens will be here just shortly, and she is the actual county auditor. I'm the internal audit manager, and payroll and benefits are under my umbrella, and Corey is the payroll and benefits auditor, and he's also the benefits support. All right, so we will get started. Slide. So on the agenda today, we're going to go over the role of the benefits coordinator. Corey is kind of filling that, Corey and I both kind of fill that position right now, but come 2020, we will be hiring someone who's a dedicated benefits coordinator and will be in that role full time. Right now, we just kind of share the duties and get it done. We'll go over the county provided benefits that the county pays a portion of or 100%. We'll go over each of those, and then we'll discuss the optional benefits that you can purchase through payroll deduction if you're interested in. We will have a discussion on the county budget and the effects on the county benefits based on the budget. Then we're going to go over the 2020 changes and future insurance changes that could be possible due to the county budget. And we'll go over the open enrollment process. And we will have time, we'll have a break in the middle that we'll have time for questions, and then we'll have time at the end, and we'll stick around if anyone has some questions. So, the purpose of the workshop is to raise awareness. Our goal today is to get all the county employees knowledge about their benefits and to help them understand what is offered and what is provided to them as part of their employment package at Wichita County. We try to provide an in-depth information about all the insurance products, both the ones that the county provides and the optional products. And we basically just want to provide an overall greater understanding of what benefits are available to you and which ones you are provided, because you don't always see those benefits when you get your paycheck every other week, but the benefits that the county provides are so great that it's important for you to understand them and be able to take advantage of them if you need them. So the role of the county benefits coordinator, we do the financial side of the benefits, so we do all the setting up the payroll deductions and collecting the money for your insurance premium and paying the bills and reconciling the bills. When we have new employees, we go over the products with you and help you get enrolled. And then if an employee terminates, we turn off the coverage and we make sure that if you want the benefits after you leave employment, then we get that fixed up for you. We also do the COBRA. If you've left employment, COBRA is allows you to keep your insurance coverage for up to 18 months in most cases. After you've left employment, you do have to pay for it, but you are offered the option to keep your insurance. Let's see. Right now, because it is just Corey and I doing the benefits coordinator duties, and it's not our full-time job, we also do internal audit. We ask that you set an appointment to see us if you're going to come over, just because we don't want to be out doing an audit or not be in our office or be tied up and not be able to assist you when you come in. So if you want to see us right now, we ask that you just give us a call and let us know that you're coming over, or send us an email, and we'll be happy to set a time for you. As I said, come January 2020, we will have a dedicated benefits coordinator, and so our time will be more open to people stopping by. We do also plan and coordinate the open enrollment, which is this presentation this week, and providing all the information on SharePoint, and also setting up the one-on-one sessions for next week. Those of you that don't have an email, I will talk to you after the presentation about how to get you scheduled for your one-on-one sessions next week. But emails have been sent out going over all the benefits and how to schedule an appointment. So if you're watching this on the YouTube channel, please be sure to click that link that was in the email sent out earlier today and schedule an appointment with your enroller for next week. If you show up without an appointment, you might have to wait, and then we want everybody to have a time scheduled so there's not a backlog and people aren't having to wait for their appointment times. We have a benefits email address that goes to Corey, myself, Deb, and the payroll accountant, which is, his name is Victor. If you send an email to that email address, benefits@co.wichitatx.us, that goes to all of us, and that ensures that one of us can get you an answer within 24 hours. That is our goal, to respond within 24 hours. So if you've sent us an email and it's been more than 24 hours, more than likely we missed it, so please send it to us again. But our goal is always to get you a prompt response. And so whether it's benefits or payroll related, you can use that benefits email address, and you can be sure that goes to all of us. So all these resources are saved to the county SharePoint. The county SharePoint is, if you log into Internet Explorer, it is, for most computers, it's the home page when people get onto the internet. And it's just an intranet where HR and benefits and IT can save information for the employees to access. So we have information on the health reimbursement arrangement, flexible spending account. You all that are in here today, you will get a copy of all these to take with you, but they are all saved electronically too. So if there's anybody listening that would like a hard copy of these, just shoot us an email at benefits email address, and we'll be happy to send one in the interoffice mail. So the first benefit we're going to talk about today is your retirement, and that is through the Texas County and District Retirement System, and you're going to hear me refer to that as TCDRS. So the way it works is all full-time employees are automatically enrolled in the retirement system. You have 7% of your gross salary sent to TCDRS on your behalf, and it's deposited into an account in your name. So the money that's taken out of your paycheck and deposited into TCDRS, that's always your money. So regardless of what happens with your career at Wichita County, that money belongs to you. But the good thing about that money is while it's deposited at TCDRS, it grows a guaranteed 7% interest every year. So every year on January 1st, whatever money you have in your account at TCDRS, you're going to get 7% interest based on that. So huge, huge interest rate right there. That's great. The county matches your retirement 2 to 1. So every $1 that you're going into your retirement account, when you actually retire from Wichita County, the money that's in your account, both your deposits and your interest, is matched 2 to 1. So if you have $100,000 in your account when you retire, you'll get $200,000 of the county's money put into your account, and then your annuity is going to be based on that $300,000. So 2 to 1 matching, that's a great deal. I've not worked anywhere else that's had that great of matching. But great benefits do come at a great cost to the county, and that is close to $3 million per year for the county to provide the retirement benefits to employees. So the only way to get the county matching is to actually retire from Wichita County. And to do that, you have to take a few steps. The first step is to become vested, and that is with 8 years of service. So work with Wichita County for 8 years, and you have your 8 years of service, and you are eligible to receive the county matching at a later date when you become eligible to retire. If you worked at another county that participated in TCDRS, or if you worked at a city that was in TMRS, the Texas Municipal Retirement System, or JRS, ERS, they recognize years of service from those other retirement systems. So if you have prior years of service with one of those, and it's in this booklet if you want a list of those, you can just call them and let them know of those prior years of service, and they will credit your account with the years of service. So what that does is it gets you closer to vesting, and it'll get you closer to retirement eligibility because you'll have the years of service, but it won't actually deposit any money in your account. So it's not going to affect the dollars in your account that you get when you retire, but it will get you closer to meeting those milestones. So the first step is to become vested with 8 years of service or proportional years of service. The second step is to become eligible to retire, and you can do that 3 different ways. Age 60 with 8 years of service. So if you've worked for Wichita County for 8 years, you're 60 years old, you're eligible to retire. Any age with 20 years of service. I have 13 years of service here at Wichita County. I worked for a school district in Nocona for 5 years, so that's 18 years of service. I'll be eligible to retire in 2 years. Now, my money in my account's not quite big enough to actually, pay for my lifestyle for the rest of my years. So I won't actually retire then, but I'm eligible to retire. So if I wanted to, I could retire and then go work somewhere else. So 20 years of service, eligible to retire, and then the rule of 75, which is your age plus your years of service equals 75. And you must be vested. So you must always be vested, and then you can become eligible to retire. TCDRS will also recognize up to 5 years of military service. So if you were in the military before you came to work for Wichita County, you can fill out a form, send them a copy of your DD 214, and they will recognize up to 5 years of service that way. And then the third step is to choose an annuity option. So once you're eligible to retire and you get close to wanting to plan to retire, you can use their annuity planning tools on their website, which is tcdrs.org, and you can actually project out what your retirement will be, or you can schedule an appointment with me, and I'll be happy to help you do that, and we can run projections and see what your annuity will be. So this is just an example of an employee that is going to be eligible to retire. So this kind of just shows it in dollar terms, what I just went over. So this employee is age 35, and they have 10 years of service with Wichita County. So they came to work for the county when they were 25. They started making $25,000. Over the years, they've got a couple raises, and now they're making $32,000. So 10 years of service, they'll be eligible to retire in 10 more years when they have 20 years of service, and they'll be age 45. So when you go online to do the projections tool, it'll ask you for a couple assumptions. One is, how much do you think your annual salary increases will be? And number 2 is, what type of annuity do you want to select? There's several different options. So for this scenario, I did 0% annual increases over the next 10 years, and I did a single life annuity. So what single life annuity means is they're going to guarantee that this person gets a check each month for the rest of their life. So if they were to retire at age 45 with 20 years of service, their monthly annuity would be $1,687, and annually it would be $20,244. So that means if they retire at age 45, for the rest of their life, they're going to get $20,000 every year for the rest of their life. But let's say they wanted to keep working. So if they work 5 more years and wait till they're age 50 to retire, instead of $20,000 a year, they would get $32,500. So every year that you continue to work, you're continuing to deposit money in your account, and it's continuing to grow 7%. So every year that you work, your annuity when you retire is going to be bigger. But also, just because you've let's say this person has worked his 20 years, and he's done working for Wichita County, but he's not ready to retire yet. Just because he's left employment doesn't mean he has to file for retirement just yet. He can leave his money in his account, and it'll continue to grow 7% interest. So if he gets his 20 years of service, but he waits until he's 50 to retire, instead of that $20,000 a year annuity, he'll get $29,500, because over the 5 years, it's continued to grow 7% interest each year. Now, if he works 5 more years till he's age 55, so he has his 20 years of service, and then he waits 10 years to retire, instead of the original $20,000, it's going to grow to $43,000 a year. So you can see that 7% interest, because he's not continuing to deposit these last 10 years down here in this scenario. It's just that 7% compound interest is growing his money at a phenomenal amount. So he's going to get $43,000 a year for the rest of his life. And this is something that you can do when you go online and set up an account. You can run these projections yourself, and you can see, what if I work for the county for 20 years? What if I work for the county for 25? And just kind of play around with the numbers. It's pretty fun to do, in my opinion. But all right. So what if I leave employment? As I said earlier, just because you've left employment at Wichita County doesn't mean you have to withdraw your money. You do have a few options. First and foremost, the money in your account that you have deposited in there and the interest that it's grown is your money. So you can take it out if you want to. But if you leave it in there, it continues to grow 7% interest. And this chart right here just kind of gives an example of someone who had $12,000 when they left employment at Wichita County, and they left it in there to grow 10 years. That first year that they left it in there, they got an interest deposit of $845, 7% interest. The next year, because their principal balance has grown by that $845, the next year their interest is going to be higher. It's going to be $904. Next year, $967, $1,000, $1,100. Every year that they leave their money in there, they're going to get more interest grown on it. So after 10 years of just leaving their money in their account, they'll have earned close to $11,700 in interest. And their balance will have grown from $12,000 to $23,700 just by leaving it in there and letting it grow at that 7% interest. So keep that in mind. If you leave employment at Wichita County, you do not have to withdraw your money. You will have an account at TCDRS. The only thing I do recommend is make sure that you have your contact information updated with them, because they will send you an annual statement and let you know what you have in your account. And you want them to be able to get a hold of you, to send you that statement. So make sure you keep your contact information update with them. The second option is to roll your money over to another tax qualified account. So if you have an IRA or 401k, you can roll your money over from TCDRS over to that account. So if you do that, you will lose out on the 7% interest, but you won't have to pay a tax penalty on it. IRS rules say if you withdraw your money out of the account and you're younger than 59 and a half, you'll have to pay an early withdrawal penalty. So if you roll it over, you won't have to pay a tax penalty. Now, if you withdraw it, you'll have to pay a tax penalty, and you'll have to pay taxes on that. Now, what I didn't mention earlier on option one, as long as you leave your money in your account, if you were to come back to work for Wichita County and then retire, or another TCDRS employer, if you were to come back later and work, as long as your money is in their account, when you file for retirement, that money will get matched 2 to 1. If you ever withdraw your money and then come back to Wichita County, you can't ever put the money back into TCDRS. So you can't ever get that matching unless you leave it in there and file for retirement. Also through TCDRS is a group term life insurance policy. The county pays this 100%, so you don't have to pay for this. And it is equal to 1 time your annual salary. So if your annual salary is $25,000, you have a life insurance policy equal to $25,000 right now. You're already covered. If you make $50,000 or $60,000, your life insurance policy is equal to that amount. So 1 time your annual salary, you're automatically enrolled. You don't have to file any paperwork for this, but what you do need to do is select a beneficiary. So you can do that by going online at tcdrs.org and naming a beneficiary, or we do have some beneficiary forms that you can fill out and fax into TCDRS. Now, one thing to keep in mind, if you get married and later get divorced, please go online and change your beneficiary, because if you were to pass away and you still have your ex-spouse named, that check is going to go to your ex-spouse. So just make sure you keep that in mind. They are going to pay out to who you have named as your beneficiary. So let's keep that up to date. All right, now I'm going to turn it over to Corey, and we're going to start talking about health insurance. And go.
All right, before we start talking about the actual rates and all the insurance for 2020, we'll go over what kind of drives the rates and what determines our premiums and what the county is going to pay and what the employees are going to pay. So the one thing that drives our premiums is what we call the claims to contribution ratio. So that's determined by the total claims against the plan and the total contributions paid into the plan. So Wichita County currently pays 100% of all employees' premiums, full coverage. So, and that will not change in 2020. The county will still continue to pay the full employee-only portion. And then employees also have the option to add dependent coverage. So you can add your children, your spouse, however you want to, but the employee is responsible for that portion of the premium coverage. So whenever you take in the total amount that the county pays for your insurance and the total amount that the employees pay for their dependent coverage, you have the total contributions paid in towards our plan. Then you have claims. So the claims is anything that's medical or prescription that goes against the plan that the plan has to pay out. So anytime you have a doctor's visit or go to the emergency room, there's going to be costs incurred, and those claims are paid out by the plan. So the contributions to claims determines where the rates are going to set in. So if our contributions, the amount that the county employees pay into the plan, is higher than the amount paid out through claims, then we get lower rates. If the contributions are lower than what the claims are, then you get an increase. So this is going to, let's go to the next one. This is going to show that as of September 30th, 2019, the claims to contribution ratio is 120.13%. So what that means is you would think we're at least 20% over where we're supposed to be. The actual break-even ratio for claims to contribution is 94%. The way that works is we actually go through the Texas Association of Counties, so they handle all our insurance products, and they go out and they bring in Blue Cross Blue Shield, which is what our health insurance is through, and they bring in Navitus, which is our prescriptions. So they'll bring in Blue Cross and Navitus, and they put everything together, and Texas Association of Counties handles everything. So from 94% to 100%, that 6% is a service fee for the Texas Association of Counties. So as long as we're sitting at 120%, we're actually, the Texas Association of Counties is actually not getting paid to handle our benefits or handle our insurance products. So they're actually losing money on us. So technically, that's why we would normally see in this situation our insurance premiums increase every year. We were actually about 7% higher than what we were when we did this last year, so we didn't do a very good job of cutting some corners and making some changes, but we'll go forward and we'll try again for this next year. The actual contributions to make up that 120%, so the county and the employees that have dependent coverage paid in $4.1 million into our plan over that time period. The actual claims paid out by the plan was $4.9 million. So we were about $800,000 over on claims from what we actually put into the plan. The actual 94% cutoff is $3.8 million. So we were about $1.1 million in too much expenses for 2019. So all that to say that when Texas Association of Counties came in to renew our insurance, we got I believe it was actually a 9.95% increase in our health insurance for 2020. And they said they did us a favor because they did not want to release a 10% or greater. They actually wanted to go quite a bit greater than 10%. So they cut us off at 9.95%, hoping that we'll have a better year next year and they won't lose next year. So 2019, our current insurance rates are $678.94 per employee. And we will talk about an HRA program that was implemented a couple of years ago. So by the time the county pays $678.94 for every employee, every single month, plays in on the HRA, the actual estimated expenses for 2019 for health insurance for the county alone is roughly $4.2 million. We did see a 9.9% increase for 2020. So the premiums for each employee is going up to $746.16 for every employee every single month. What that means is probably an estimated increase of about another $400,000 of expense for Wichita County for 2020. So Wichita County is probably going to be looking in the $4.6 million range to cover our health insurance for 2020. We did not have any changes to the health insurance plan for 2020, just the increase in the rate. So the increase did flow over to the employee or to the county, and any dependent coverage will fall over to the employees as well. The plan just still remains with the Texas Association of Counties, and we still have our Blue Cross Blue Shield and health insurance coverage and our Navitus prescription coverage. And employees continue to have the option to pay for dependent coverage for their dependents. We'll go over some definitions of some things that we'll talk about that you will need to know whenever you utilize your health insurance plan. The first thing that you'll need to know is the copay. The copay is short for copayment, and the copayment is anything that you're going to pay if you go to your regular doctor visits is the first thing that you're going to pay. So if you go to your regular doctor because you're sick or because you just need to have some kind of illness or something, some kind of checkup, the co-insurance at your regular physician is $40. That's the copay. If you go to a specialist such as an ophthalmologist, the copay is $50. And if you go to the emergency room, the copay at the emergency room is $300. Now, that's the first thing you're going to pay when you go to your doctor's visit, and that's generally what all you're going to be charged at a doctor's visit. However, if you go into your doctor because you have a broken bone and you're going to have x-rays and you're going to have casting and you're going to have additional charges built into that, that's when the deductible kicks in. So after you paid your copay, if you have any additional expenses, such as you would at an emergency room or such, the deductible, you have to pay the full deductible before the health insurance plan actually kicks in. So the deductible for 2020 is going to be $3,000 per individual on the plan. So now you have to pay the full deductible of everything, any kind of expenses that you have that are outside of your normal copay. So you'll pay whatever up until you hit $3,000. Now, if you satisfy your full $3,000 deductible, the health insurance plan kicks in and the health insurance starts paying 80% of all claims after the deductible. And then you're required to pay 20% of all claims up until the co-insurance maximum. So you've had your $3,000 deductible, you pay 20% of all claims on your co-insurance up to $4,150, which is what the co-insurance maximum is. Now, if you do have an extended amount of cover or, claims for the year and you are able to meet your deductible and your co-insurance total out of pocket, then you would have that would be your total out of pocket. So your total out of pocket is $3,000 deductible, $4,150 co-insurance of $7,150, and then the plan kicks in and pays 100% after that. And we will have a little example in a little bit to show you what the total cost would be. Let's see, we talked about that. So for 2020, the health insurance rates again for employee only is $746.16. If you want to add child coverage, the coverage does go up to $930.94. The county continues to pay the $746.16, and the employee would pay the $184.78 per month. That would come out of your paychecks at $92.39 semi-monthly. If you want to have children coverage, it goes up to $1194.32. The county still continues to pay the employee-only portion, and the employee pays the $448.16 a month for children coverage. Spouse coverage goes to $1563.04 or $816.88 per month for the employee. And family coverage goes up to $1,914.16 or $1,168 a month for each employee, or for the employee to pay. Preventive care is if you go to your doctor each year, have your annual physical, your annual checkup, your annual blood work, sometimes annual x-rays depending on if you're a smoker or not, depends on whatever they are. But you go in for your annual preventive checkup every year, that is covered 100%. So there is no copays. Make sure that if you go in for your annual checkup that you tell them, if they try to tell you you got a copay, if it's just an annual checkup, it is no copay. It's considered preventive care because the idea is to try to get you to want to go do your checkups every year, catch the things before they're too far gone and create the higher expenses, because the earlier they catch it, the lower cost it's going to be to you and to the plan. Vision exams, just a regular routine annual physical or vision exam is also considered preventive care. So if you go to your optometrist and for a regular exam, it would be considered preventive care and no copay on that as well. If you go to your regular physician office visits, any kind of consultations, things like that, $40 copay. If you go to specialty care, it's $50 copay. And if you go to the emergency room, it is a $300 copay. And after you pay the $300 copay at the emergency room, the plan does cover 80%, unless it's something that's billed against the deductible, but the plan should cover 80% under co-insurance rules. The plan also has an MD Live built into it. The MD Live is a virtual doctor, or not really, an online doctor, or you can download an app and you can call in an 800 number or go online, but you can set up an account and go to see a doctor over the phone without having to actually leave your house. The MD Live is a $10 copay, so it's a lot cheaper than having to leave the house and go to your regular doctor too at the same time. The deductible for 2020, again, is $3,000. That is for individual. For family coverage is up to $9,000. So regardless of the number of dependents, it's $3,000 per dependent or $9,000 maximum. The co-insurance is $4,150, and the family coverage is $5,300 co-insurance. One thing to note is that I'm only giving out in-network amounts, because if you go out of network and it's an out-of-network service provider, it's going to be 3 times the cost of the deductibles. So an out-of-network would be $9,000. We don't talk about that because it's so high, so we try to encourage everybody to stay in-network if at all possible. Here is our example. So this example would take that you would have to have at least $23,750 in medical expenses to utilize the full coverage of the plan. So you have $23,750 of medical expenses. The first thing you're going to pay is the deductible, which is $3,000. So you have to pay the first $3,000. You now have $20,750 of expenses remaining. Now the plan's going to cover 80% of that, and you're going to cover 20% of that $20,750, which is $4,150. Now, once you've satisfied that deductible and that co-insurance, the plan's going to cover the remaining. So if you have $50,000 in expenses, it's going to be the same scenario. You would have your $50,000, you would pay the first $7,150, give or take, and the plan would cover the rest. So anything over $23,750, the plan's going to cover pretty much at 100%. The MD Live is a virtual doctor. It's a $10 copay. You can utilize it for your general health, such as allergies, asthma. You can use it for pediatric care, such as the colds and flus, behavioral health, such as anxiety, depression, and that's a big one if you do have to use some kind of behavioral health, because a lot of times those are repetitive and you have to continue to go to see your physician or whatever. So at $40 or $50 a copay every single month versus $10 a copay every single month could be very, very helpful to a person that's trying to save money. You can download the MD Live app on your phone and have it right there in your phone at any time. You can go to mdlive.com/BCBSTX, or you can call the 800 number. And once you'll just have to set up a profile. The MD Live, that it is an actual doctor on there, so they can actually call you in prescriptions. So if you go on there and they say you have a sinus infection, they can actually call you in a prescription to your local pharmacy, and you can go pick it up that way. Our prescription coverage is through Navitus. There is a $250 deductible for prescriptions prior to the plan actually kicking in. That's $250 per individual, up to $750 for the family out of pocket on the deductible. So when you go in January 1 and you have to fill your prescriptions, you will pay full cost of the prescription up until you reach that $250. Now, say you have 2 generic brand name drugs. As a general rule, once you satisfy the deductible, the generic copay is going to be $10 per copay, unless it's less than the copay. But if it's a $10 copay, most likely the prescription is going to cost a lot more than that. So it could be a generic drug that you have 2 different drugs, and one may be $70 a month, and the other one may be $50 a month. So the first month you're going to pay the full $120 because you have not met your $250 deductible. Same way the second month, because you would have now hit $240 of your deductible. So become March, you would pay the remaining $10 of your deductible. Then you would start paying the copays on the coverage. So after you met your $250 deductible, generic copayments are $10 per prescription. Brand name drugs are $30 per prescription, and non-preferred brand name drugs are $50. The non-preferred brand name drugs are generally the ones you're going to see on TV. They're the high cost claim. Something like that's probably a $50 copay to you is most likely to the plan $1,000 or greater for one prescription. So those are the ones that are a lot higher. You can get a 90-day supply at any retail pharmacy. So if you have a maintenance condition such as asthma or something of that nature that you take on a recurring basis, you can get your doctor to write you a 90-day supply. You can go to any retail pharmacy. They'll give you the 90-day supply for 2 copays. So you save a copay right there instead of doing it once every single month. You can also do that same thing through mail order. The mail order is through Costco. You do not have to be a member of Costco to utilize it. You just go onto the site and sign up for the mail order through Costco. they'll deliver you a 90-day supply directly to your house, and it's still just 2 copays, so you save a copay that way too. And I'm going to turn it over to Linda, and she's going to talk to you about the HRA, which will help offset some of these medical costs that I was explaining to you.
Yes, so an HRA stands for Health Reimbursement Arrangement. And what that does is, as Corey mentioned, it helps offset part of your out-of-pocket costs that you have with your insurance. Corey went over the deductible, the co-insurance, the prescription deductible. Those types of things are money that's actually coming out of your pocket that you're paying towards your services, towards your health services. So the HRA will reimburse you a portion of that to offset some of your costs. The county put in the HRA. This is going to be the county's. This is the county's 3rd year for having the HRA. And the reason the Commissioners Court decided to implement the HRA was because, as Corey mentioned, the health insurance rates are just increasing year after year. And this was an idea that they had to try to reduce the insurance cost. And what it does is it shifts some of the burden from Blue Cross Blue Shield over to the county. So instead of Blue Cross Blue Shield paying for all these costs, the county is paying for a portion of it. And what it did is it reduced the insurance premiums to the county, and it actually saved the county $750,000 last year. So there is some paperwork that you have to fill out to get your reimbursement, but it's a small thing to have to do to help save the county overall some money and to help us keep our insurance benefits. So I'm going to go over all that with you. If anybody's watching the presentation right now, everything I'm going over is the same in 2019. So if you've hit one of these deductible or co-insurance this year, please take action to get your HRA submitted. I'm going to go over how to do that, but I just want everybody to know that's listening that the 2020 benefits are exactly the same as 2019 benefits. So the HRA is administered through Higginbotham Insurance. They're a third party that actually is going to process the HRA benefits. And why that is because of a HIPAA law, it's federal law, that says your employer should not know your private medical issues. So even though the county pays Blue Cross Blue Shield, we have the insurance through Blue Cross Blue Shield. If I were to ask Blue Cross Blue Shield, hey, give me a report and tell me what all doctors Corey has gone to this year, they're not going to do that. They're not going to provide that information to us at the county. So, and that information is private, and it should be kept private. So that's why we have contracted with Higginbotham to take care of these things so they can handle your insurance needs without you having to worry about us seeing who you've gone to, or your employer, your boss seeing that. So how it works is the HRA will cover up to $2,300 of the in-network deductible, up to $1,150 of the in-network co-insurance, up to $150 of the $300 emergency room copay, up to 4 visits per year, emergency room visits per year, and up to $150 of the prescription deductible. And the prescription deductible is per individual, and so you can get $150 per individual that's covered under your health insurance plan. So if you have 4 people in your health insurance plan, all 4 of you will be eligible. 3 of you, or up to, there's a maximum of 3. So all 3 of you will be eligible for the prescription deductible. You can elect to pay for the expenses up front and then fill out the paperwork and get reimbursed, or you can let your provider know that the county has the HRA, and you can give them a copy of the HRA flyer that we're going to give you a copy today, and we also have on the SharePoint, but it goes over it with them. Many providers will accept assignment, so they will accept that, and what it does is they're just basically going to wait to get that check from Higginbotham. So if you do that, you will tell Higginbotham to send the check directly to the provider. Now, if you fill out the paperwork, let's say you get a bill from your provider for your deductible, you fill out the paperwork to get the HRA reimbursement and the check comes to you, you have to pay your provider, because your provider, if the check comes to you, then it's your responsibility to pay your provider, or you're still going to owe them for that. So just keep that in mind. Now, we're going to go over the flexible spending card just in a bit, but what the flexible spending card is a card that you can put pre-tax dollars on to use for medical expenses. If you use your flexible spending card for deductible or co-insurance, prescription deductible, and you get reimbursed from the HRA, that reimbursement will go back to your flexible spending card. So just keep that in mind that you'll have to use those, you'll have that money available, so you don't want to wait too long in the year and then not be able to use those funds. So on the in-network deductible, Corey mentioned that the in-network deductible is $3,000. And I'm saying in-network several times because the HRA, as Corey mentioned, the in-network is cheaper to you and to the plan, but also the HRA will only reimburse for in-network services. So $3,000 in-network deductible. The member only is responsible for the first $700 of that. After you've met the first $700 of your deductible, the HRA will kick in and will cover the next $2,300. If every time you go to a doctor, you're going to get a form like this from Blue Cross Blue Shield, and it's called an explanation of benefits, and it's going to go over everything that your provider billed to Blue Cross Blue Shield, how much Blue Cross is paying, and how much your out-of-pocket is. At the bottom of that sheet, it's going to have the total, how much deductible you've reached for the year, and how much your co-insurance. So that's how you're going to know if you've gone over $700 for the year, because you might not necessarily hit that $3,000 the first time you go to the doctor. So it could be several visits in, but you'll get an explanation of benefits that will have the total total through the year-to-date total, and then so that's how you'll know how much you've reached for the year. The co-insurance of the $4,150 co-insurance, the HRA will reimburse $1,150. So you're responsible for the first $3,000 of that before the HRA kicks in. And on the prescription deductible, you're responsible for the first $100 of the $250 prescription deductible. Then the HRA will kick in and pay the remaining $150. On the ER copay visits, the ER copay is $300, and the HRA will cover $150 of that. So the employee is responsible for $150, and the HRA will cover $150. The ER visits are capped at, the HRA reimbursement for ER visits is capped at 4. If you have to go to the ER more than 4 times during the year, you're not going to be capped by the health insurance by that, but you won't get reimbursed from the HRA. So at the 5th visit, you will have to pay the full $300. Now, if a true emergency, if the provider bills as not a true emergency, Blue Cross Blue Shield will bill you more for your out-of-pocket cost. So they will only pay 60% instead of the normal 80%. So just keep that in mind. The emergency room visits are going to be the most costly to you because you'll have to pay your deductible and 20% co-insurance. But also, if they deem it as not a true emergency, you would have to pay 40%. If you have an absolute emergency where you're having a stroke or heart attack, absolutely go to the emergency room. We're not trying to advocate for you not to do that, but just keep that in mind. If you're just having a cold or flu symptoms and you don't think it's a true emergency room, then you might want to go to urgent care first. So how do you get reimbursed? You have a couple different options. The first option is just to fill out a manual claim form. We have these claim forms saved to the county SharePoint. You'll submit that claim form along with a copy of your explanation of benefits that shows how much of your deductible or co-insurance you've met through the year. Or if you don't have these, you can log into Blue Cross Blue Shield and print out a summary that shows your year-to-date expenses, and you can include that summary with your claim form and submit it that way. You could also connect your Blue Cross Blue Shield account to your Higginbotham account through something they have called Claims Flow. So the way that works is you'll go online and create a Higginbotham account. Once you're in your Higginbotham account, you'll click on the Claims Flow button, and then you can log into your Blue Cross Blue Shield account from there to link them. The benefit of doing that is it actually keeps track of your expenses throughout the year. So if you've gone over your deductible or co-insurance and you're now eligible for reimbursement, it'll actually send you a notification that says you're eligible for a reimbursement. And all you have to do is log in and submit. You don't have to print out any forms or fill out any documents because they have that information linked to their site already. So just to recap, we have the HRA that's administered through Higginbotham Insurance, and all employees that are covered under the county insurance are eligible for the HRA. You don't have to sign up for it, you're automatically eligible, but you do have to be covered by the county health insurance. Again, the reason we use Higginbotham Insurance is because of the HIPAA privacy law, and that's to protect you. Please keep in mind that if you were to email us with any of your EOBs or your questions about your medical providers or your prescriptions, if you were to email that, that becomes subject to open records request because that is a public record at that point. So if you want to meet with us and discuss anything, we can set an appointment to do that, but I would be careful about not sending it through email. And Higginbotham also has people available to answer questions if you have questions about the HRA process or how to fill it out. Okay, so now I'm going to turn it over to Deborah Stevens. And she's going to talk about the flexible spending accounts.
So if we're live streaming, I'm sorry for the delay to the live streamers.
Yeah.
The flexible spending account is a wonderful, greetings to everyone. I see some familiar faces here. I don't see all our new people. Oh, lots of them. So the flexible spending account is a way for you to pay for your medical expenses with what we call pre-tax dollars. So normally your paycheck, you get, say you paid $1,000 a month, you don't get $1,000 a month to spend because there's all kinds of stuff taken out. There's your Social Security tax and your federal withholding tax, and those two things together is about 20%. And so what the flexible spending account allows you to do is use those dollars before the taxes are taken out. So whatever you put into your flexible spending account comes out whole. So if you had $1,000 and you decided I'm going to put $200 of that into my flexible spending account, that $200 would not have any taxes deducted from it. So it's a really, really good deal, and most everyone will have some kind of medical expense during the year. Now, you do have to plan carefully for how much you put in there because it is a use it or lose it kind of account. So if you don't spend all the money, there's not a refund. But that's easy to estimate, and if you know kind of what your history is, or you know I go to these doctors or I take this medicine, you can make a conservative estimate to come up with a good number to put into your flexible spending account. The other part of the good news is the county saves money also if you do that. It also saves the county the amount of Social Security tax that they would normally pay. So for Social Security, you put in 7.65%, but the county matches it 7.65% as well. And so both entities, you and the county, both would save that Social Security tax. So it's a good deal for employees and it's a good deal for the county. Now there's two different kinds of flexible spending accounts. There's the health care spending account, which covers all your medical needs, and you can put up to $2,700 a year into that account. The other one is a child or dependent care account, and you can put up to $5,000 a year into that one. They're basically the same, but they operate slightly differently. So I'm going to talk about the health care flexible spending account first. So any costs that you incur by going to a health care provider, whether it's a doctor or maybe it's for glasses or hearing aids, whatever it might be, healthcare provider can be paid, prescriptions can be paid with your healthcare flexible spending account. And what you'll do is estimate the amount of money that you think you're going to spend on all healthcare related expenses during the year. And once you come up with that number, now y'all are going to be unique because everybody in this room is a new employee, so you're going to estimate how much you're going to spend till December 31st, so not very much probably. And you're going to put that amount into your flexible spending account. But when you do that, let's just say we're doing it for next year and it's going to be the whole annual amount, because folks that are watching because they're going to sign up for the whole year. You're going to determine what you're going to spend for the whole year, and then you're going to make that declaration at open enrollment, and then you will get a debit card before January 1st that has that whole amount loaded onto it, and it will be available for your use at that moment. It's like getting an interest-free loan from the county. So if you put, say you want to put $1,200 into your flexible spending account, on January 1st, you will be able to spend, you'll have a debit card, it'll have $1,200 on it, and you can start spending it right then. And then you will pay it back through payroll deduction over the rest of the year. So it's a real easy way to make some upfront payments. Linda talked about, or Corey talked about, the deductibles that we have to pay and some of the out-of-pocket costs for co-pays and that kind of thing. And that flexible spending account can make things a little easier. Some folks, they know that their kid needs braces and they're going to have to make a deposit, so they get the maximum on their flexible spending account of $2,700. Then they go in January and they get their kid started, they make their deposit, and then they have the whole rest of the year to pay it out. So it's handy for that kind of thing. It could also be used for certain over-the-counter drugs if they're prescribed by your doctor. So they have to be, you can't just buy anything on the flexible spending account, but if you have a prescription for an over-the-counter drug, then it will qualify as well. And in your flexible spending account book, there's, is it the resource guide? I think that's all the different kinds of stuff that can be purchased through the flexible spending account. And this one that Linda's holding up as well. The dependent care account is for anybody who is not able to care for him or herself and who you support. So it's like if you have a, they can be deducted on your tax return. The law allows you to put up to $5,000 a year onto, in your flexible spending account for child care. Now this one works a little differently in that you have to spend the money and then you get reimbursed. But again, it's tax-free dollars, so if you were to put $5,000 a year, it would save you about $1,000 because of the tax benefit. The deduction that comes out of your paycheck will be made over 24 pay periods instead of, we get paid bi-weekly, so we actually have 26. But there's a whole bunch of different deductions that come out over 24 rather than the 26. So there's 2 pay periods during the year where if you have any of these non-standard deductions, your paycheck will be a little bit bigger because the deduction won't come out of that. Again, the main thing to remember when you're estimating the amount that you want to put into your flexible spending account is that it is a use it or lose it kind of account. You don't ever want to leave any money in the account because obviously you just lose it, and that's your hard-earned dollars. Now, you want to use it before the end of the year, before December 31st. But if December 31st sneaks up on you and you haven't used it yet, you actually have until March 15th of the following year. But don't do that because it lulls you into a sense of complacency, and then you'll think, oh, well, I got 2.5 months. And then it'll be, well, I got a month. And then it'll be, I got 2 days, and then you'll lose it. So don't do that. Spend it during the year, and then you can renew it every year, and that's real helpful. If you decide to terminate your employment with the county, your flexible spending account terminates on that same day. So even if we don't get it turned off because, say, your boss doesn't let us know that you've terminated employment, and you go and use that, and then it takes the card, you'll be asked to refund that money. Higginbotham will come back and ask you to refund that money because you were terminated and you still use the card. So just bear that in mind. Once you terminate, you can't use your flexible spending account, or if you do, you'll be asked to return the money. This next one is an example of how you save the money using this account. So in our scenario here, we have two people. They both make $30,000 a year. This person didn't select the flexible spending account. So their $30,000 of gross wages is also their same taxable income. And so they're going to pay tax on this whole $30,000. And if we apply the Social Security of 7.65 and an average income tax rate of 12%, 19.65% of your earnings would be $5,895. So that would leave you with $24,105 to pay all of your bills. Now, this person has $2,500 worth of medical bills, and it's going to come out of that money that's already had the taxes withheld. And so after they pay the $2,500 of medical expenses, they only have $21,605 to pay for everything else. Now, this person over here decided, okay, I know I'm going to have $2,500 worth of medical expenses, but I'm going to put it into the flexible spending account. So they also have the $30,000 of wages, but this time the flexible spending account amount comes off of that before it gets taxed. So they're only going to be taxed on $27,500. So their tax, instead of being $58.95, is $54.03. So they take home $22,096, whereas this person only had $21,605 to spend on everything else. So you can tell the difference between those two scenarios simply by putting their known $2,500 of medical expenses into their flexible spending account. They're going to save almost $500. So this is a great deal. You have to plan carefully. On the next slide, we'll look at a scenario of how to do a little planning. You would just make up a little list of what you think you and your family spend on all your medical kinds of expenses. So you would want to take into account your prescription copays, the drug deductible, the dental plan deductible. Maybe you go and have a vision exam. Maybe you need glasses. Any doctor's offices that you know you're going to have. You add up all those things that you think you might need to spend during, and be pretty conservative about it because you don't want to overestimate it. And that'll give you a total amount. And once you have that total amount, then you'll tell the open enroller that's what you want to put into your flexible spending account. In this case, the savings would be $196.50 on that $1,000. So it is, again, just a super good deal. It seems like it's too good to be true, but it is just too good to be true. It is exactly that. You have to plan, and you have to know what your expenses are going to be and make a conservative estimate. Don't just say, oh, I'm going to put the whole $2,700, because if you don't spend it, you won't get it back. But with careful planning, it's a great deal. Does anyone have any questions?
So you can purchase your frames and
Sure.
like somebody like me that can't see, my glasses about $400.
Yep.
So you can do that with that.
Yes, ma'am. You just give them, it looks like a debit card, and you just pay for it with that. And it's a great deal.
I was just going to let them use the microphone for
Oh.
questions. It's the live.
I'm sorry. The question was, can you pay for glasses and frames with your flexible spending account? And the answer is yes.
Yeah, I want to be on there. It's not too country.
Does anybody else have any questions? Okay, we're going to take a 10-minute break, and then what time is it right now? 2:30, so we'll come back at 2:40.